All right. Hello, everyone. My name is Jim Posner, and I'm the founder and host of the Don't Panic Project. So every week we will be providing engaging conversations that educate, inspire, and empower people suffering from anxiety and depression. Today's guest is psychologist Dr. Devon Macdermott. Welcome to the Don't Panic Project, Dr. Macdermott.
Hello, sir.
How's it going?
Good. How are you?
Excellent. So if we could just start out perhaps by you telling us a little bit about yourself and your practice.
Sure. So I'm a psychologist and I'm in private practice, and I have a couple of different specialty areas. I tend to work with a wide variety of people, but the areas that I focus on are trauma, relationship repair, and people who struggle with OCD.
Very, very interesting, very apropos.
Yeah.
So since this is the Don't Panic Project, we're here to talk about anxiety and depression. But before we get into solutions to tackle these issues, could you maybe tell us a little bit about what goes on biologically with people that are suffering from either acute anxiety and on the verge of having a panic attack or just general depression?
Yeah, you bet. So there's this concept that we use. It's called the window of tolerance. And basically, when we're in between these two lines, that's where life is okay. You and I are both there right now. We're calm. We generally feel safe. We're in between here. When we go above this line, we are in fight or flight. And that's what panic usually looks like. When we go below this line, we're in shutdown. And when we're outside of the window of tolerance in either of those spaces, we kind of get it so you can see it here. When we're in either of those spaces, the same things happen to the brain. We lose contact with four of the most important areas of our brain, and one other area really gets the volume turned up. So the four areas that we lose contact with are the frontal lobe, literally right behind the forehead, responsible for a lot of planning and forethought and abstract thinking. We lose a good portion of the left hemisphere, which is also a lot of planning, forethought, and abstract thinking. We lose contact with Broca's area, which for most of us is kind of right here in the middle of the head. And what that does is it's language production. And then we also lose contact with a whole bunch of structures that a bunch of people have started calling the self-sensing Mohawk. And they call it the Mohawk because it runs right along the divide in our brain. And that's called the self-sensing Mohawk because it helps us sense ourselves. It helps us understand where our body is in space and what our emotions are doing and how we feel. You might even say that it's part of our intuition. And quite literally, you can put someone in an MRI, and when they're outside of their window of tolerance, all four of those structures have very decreased blood flow. They're literally not working. And so as an example, when people are really panicked or really frightened or really shut down, a lot of folks will say that they can't really say anything, or the things that they do say they don't actually mean. So that's why if we're in a big fight with our loved ones and we say something that's really cruel and later we're like, God, why did I say that? That's why, because Broca's area is really offline. And then the one area that is way, way online is the amygdala, which is the emotion center. So it's kind of dead in the center of the brain there. And it's basically on fire. So we're losing contact with all the things that allow us to edit ourselves and use reason and use our coping skills and stay calm. But what is working really well is the, oh my God, it's an emergency explosion center.
So the fighter, so it sounds to me like you're saying the amygdala is kind of the fight or flight center of the brain, and that area is still receiving blood flow or even increased blood flow.
Yes.
When this is going on, and the other more kind of parts of the brain that regulate our rationality, or for lack of a better term, are losing blood flow. So
wow,
this
way of doing things was originally created because thinking is slow. In comparison to emotions, thoughts move at glacial speeds. So this way of doing things was really created for there's something kind of moving around in that bush. Oh my God, let's run. It might be a tiger. If we take the time to piece it together, these are really old systems. So this is from like thousands of years ago. If we take the time to piece together, like kind of orange, stripy, big eyes, claws, we're dead. And so that's what this is all for. But in modern life, there are some ways in which it really, really can hinder us.
Right. So are there different types of depression and anxiety?
There are a lot of ways in which depression and anxiety can manifest. So I would almost say that there are millions of kinds of depression and anxiety, because it really is different for every single person who experiences it. So for some folks, there can be a bit of a difference in that some people really have a very biologically originating experience of anxiety and depression. It doesn't seem to correlate much with their experiences. It seems to kind of come out of nowhere. And then, of course, there are folks who have things like that are really kicked off by experiences. They feel anxious because they lost a job and they're in financial jeopardy. They feel depressed because a loved one died and they feel a lot of loneliness, or they're feeling isolated. So if you had to divide it into two categories, I might do it like that, but I'd say it's even more accurate to say that there really are probably millions of different kinds of depression and anxiety, because it's different for everybody.
It makes sense. Everybody's experience is different. And
yeah.
So, but let me ask you this. So would you say that on one level, some people are maybe born with a predisposition to be depressed or anxious? So it might be something that is actually genetic, and on, versus maybe other people that it's event driven.
Yeah. Yes, we definitely know that there's a genetic component, for sure. There are some disorders that have really high genetic components and some that have lower, but we definitely know that depression and anxiety have genetic components. The model that's usually used is kind of a fancy term, but all it really means, it's called the stress diathesis model, but all that really means is that some people have a much higher genetic internal likelihood than others. And if you have a high genetic internal likelihood for depression, for example, maybe you don't need much to set that off, to kind of begin that process. And maybe someone has a much lower internal likelihood and they would need a very big, very stressful set of events to set that off. Do you know what I mean?
Yes. So that actually makes complete sense, because it seems like we all probably know people who just nothing seemes to bother them.
Yes, and they're kind of immortal and
right. Whatever ups and downs, they
right through.
Yeah, they have just these blinders and just carry on. And,
yeah. And plenty of that is learned, but some of it is also genetic.
And I wonder if some of it is actually. Listen, I think sometimes that's definitely the case with somebody's personality. They do have this ability and no predisposition towards anxiety or depression or so forth. But I would bet some other people it's probably actually just a facade almost, and the reality is that they might be suffering, and it's just a strong front that they're trying to put up.
Yeah. And unfortunately, in order to kind of get through the day-to-day, a lot of people with anxiety, depression, and a variety of mental illnesses kind of have to fake it, like everything is okay. Because if they acted how they really felt, things could kind of be much harder for them in their relationships, in their work.
Definitely. So almost like a defense mechanism to a certain.
Yeah, exactly. That's exactly what defense mechanisms are. We have to kind of hold it together to get through things.
Would those people, do you think they may be more predisposed to actually eventually having everything kind of erupt in the form of an anxiety attack, or there's no way to necessarily know?
We don't know 100%, but I would say it definitely makes it more likely, because the problem is when we're holding it together and we're acting as if everything is okay, we're not getting support. We're not reaching out to the people who love us. We're not talking about what's going on, putting voice to how we're feeling is really powerful. We're not using our coping skills as much. We're kind of gripping tight to hold it together. So yeah, it definitely can make it more likely that something would fall apart.
So that actually provides the opportunity for a good segue. You just talked about coping skills, and I want to point to a quote on your website. Everyone experiences stress, but sometimes stress can mount and become unmanageable. Mm-hmm. If you feel stuck in your work, relationships, or life, therapy can help. We can make stressful experiences more manageable by teaching you to call on your natural coping mechanisms and inner strength. So, what are some of the natural coping mechanisms, and how can we activate them when we are in a time of duress?
Mm-hmm. I think actually one of the most natural coping mechanisms is mindfulness, that we can be, it's so organic. Every mammal is able to do it. It's much harder for us because we have all of these kind of fancy pieces of equipment that help us predict and plan and consider and imagine. One of the most natural coping mechanisms is to let all of those things quiet down so that we can just experience the present moment, because very often we are panicking about something in the future or past, or we are pained about something in the future or past. And so when we can root into the present moment, that really makes a big difference. Another very organic coping mechanism is social support. We're such social animals, and almost all of us have at least a couple of people who understand us and love us, and being able to reach out to those folks. I'd say that those are two of the biggest ones, but then there's just such a wide variety that helps our central nervous system regulate itself. Because when the amygdala is way turned up, the central nervous system, which is the brain and the spinal cord, but mostly we're talking about the brain, is not regulated. And so when we can teach the brain to re-regulate, that's where the sweet spot is of coping.
So when we do enact these coping mechanisms, whether it's mindfulness or reach out to for some social support, family or friends, mm-hmm. Do these parts of the brain that were having less blood flow, all of a sudden the blood flow actually increases, and the amygdala kind of gets a little more relaxed?
Yeah, that's exactly what happens. It goes from like here to here. Things even out. One of the sets of coping skills that's most useful for that, especially when people are above the window in the panic, fight, or flight realm, so that looks a little bit more like anxiety than it does like depression, is grounding skills. And grounding is basically usually using your body to remind your brain that you are right here, right now. And very often right here, right now is not actually dangerous, even though the brain kind of wants to tell us that it is. So a couple of examples of grounding skills that use your body are holding a plank position for 30 seconds or 60 seconds. It requires
holding a plank position?
Yeah, like in yoga, a push-up position, basically.
Oh,
wow. And doing that requires a lot of mental focus because it's hard, and it also really engages the body. So we tend to, when we're very panicking, we're very in our thoughts, and when we can get back into our bodies, that really helps us re-regulate. Some other examples are, I'll try to describe this. This is one of my favorite ones. When you're seated in a chair, bending over just a little bit and placing your hands on the outside of your knees with your feet flat on the floor, and pushing into your knees with your arms while you push out into your hands with your knees. And what happens is you can't really see, but like I'm pointing to my side muscles. All of those side muscles really engage. A lot of people respond really positively to that one.
I'm doing it right now.
Nice.
Do you have to? Would you have to be kind of leaned over so your back is kind of parallel with the floor? Would that be?
I'd say kind of whatever works for your physicality. The point is really to feel in your body again, as opposed to really being kind of taken away by your thoughts.
Interesting. So,
yeah.
So you're talking a little bit about this kind of mind-body relationship, which in mindfulness is actually a core theme.
Yeah, very much so. We can't separate the two.
Yeah, a lot of times in mindfulness, there's something called a body scan meditation.
Yep.
Um, I guess stress tends to manifest in certain parts of the body, like we clench our fists or grind our teeth,
Yeah.
or hunch our shoulders. So do you think maybe one of the reasons that exercise you're talking about works, maybe it kind of rechannels the focus of energy, or is it from those areas that?
Yeah, I think it brings awareness to tension spots. I think that it gets us into the present moment. It gets us into our bodies as opposed to really being taken away by our thoughts. All of the above.
So actually, I mean, the moment that you say to yourself, I'm feeling a little anxious and I'm going to do this exercise, you are actually setting an intention to be present.
Yep. Yeah.
So you're actually bringing awareness to the fact that, you know what, I'm feeling a little anxious. Let me do this exercise. And instantly now I'm not thinking about maybe the test that has me worried, or the meeting, or the relationship or the argument. And I'm setting an intention to do something that grounds me and makes me feel present.
Yeah. Yeah. I always verbally reward my clients when they're like, well, I mean, like, I noticed that I was having all these panic feelings, but I didn't really do anything about it. And I'm like, great, you noticed. That's fantastic.
Oh, that's right. They've learned to kind of cultivate that awareness.
It is by far the hardest part. Holding a plank for 30 seconds is really not that hard. You just need to find 30 seconds and decide to do it. The awareness that you need to do it, instead of just letting ourselves kind of ruminate and panic, that's the really hard part.
Absolutely. I can relate. As you know, I'm a meditation teacher, and that's really what it's all about: is bringing awareness to your thoughts, your feelings, and your emotions.
Yep.
When you bring that awareness to them, then you can deal with them. And before I was a practitioner of mindfulness, those thoughts, feelings, and emotions would take control of me, and they very much were happening and occurring on the subconscious level, I guess. And before I know it, I'd be overwhelmed.
Right.
Because the amygdala would be going crazy, and the other parts of my brain were shutting down.
Yeah.
So,
catching it is the hardest and the most important part.
Thank you for explaining it so eloquently. Actually, it makes it. So we actually have just touched on this. You incorporate some mindfulness techniques in your work. What are some methods what are some techniques or methods that you would maybe teach people in your sessions with clients?
So we definitely do a lot of grounding, especially when I'm working with people who really struggle with a lot of anxiety. And I definitely teach it to my trauma folks as well. A lot of that physical stuff, getting back into the body. There are so many ways to do it. Probably one of the most useful, but also one of the hardest, is learning to be mindful of our thoughts. We so often take our thoughts to be truth. Hook, line, and sinker. If I'm thinking it, it must be real. And I know you do that. You work with this all the time. And so if we can start to notice our thoughts, I always use a hand gesture to kind of explain it. If we can start to notice our thoughts from just like a step away and realize that they're kind of just words in our heads a lot of the time, that gives us so much power, because instead of it being like this, kind of suctioning onto us, we have a little bit of distance. And at this distance, you can have a conversation with the thought. You can question its validity. You can do all kinds of things with it. When it's on top of you, you can't. And so that mindfulness, just that little bit of distance, that little bit of pause, can really make a gigantic difference. I think that's the most powerful use of mindfulness, to observe our thoughts.
How do you teach clients to cultivate that awareness, though? As we were just alluding to, one of the most difficult things, it's easy to kind of talk about, bringing awareness to your thoughts when things aren't, when the amygdala isn't firing and
Yeah,
the
you
rational
do talk about hard to
brain are receiving blood flow. But when, you're when you're feeling panicky or anxious, that's the trick. So
yeah. I'd say step number one is grounding. Step number two, because if you're completely outside of your window of tolerance, it's very hard to be mindful. You have to come back inside first. Even if you're right there at the edge, that's better than nothing. Step two is to have already created a practice. That's one of the helpful things about therapy. It's one of the helpful things about what you do, to have already created a practice where you are attempting to be mindful. You're attempting to be conscientious of your thoughts, as opposed to, again, just kind of taking them hook, line, and sinker. I often suggest to people even something as simple as, I'm having the thought that, can make a world of difference. There's a big difference between I'm a loser and I'm having the thought that I'm a loser. It gives you that kind of observation distance where you can question, consider, as opposed to just feeling taken over by the thought.
Right. Makes sense. So are there other exercises that people can do throughout the day? I mean, as a meditation teacher, I tell people that in order to kind of cultivate this skill, you need to meditate, quite frankly. And that's the training that's the training you do for when the real life situation triggers you, and then that you're learning to then go to that mindfulness when you are triggered. So are there certain other exercises? I mean, I know we were talking about the hand to the outside of the knees thing, but that seems like it was something that was in the moment. So are there other types of exercises throughout the day that
there are so many things that you can do, and I'd say practice makes better. The same idea of like, don't reserve it for when you're feeling like you're going to fall apart, because we really need to be, it's like a muscle. If we try to go to the gym and bench press 300 pounds, we're going to hurt ourselves. If we go 2 or 3 times a week and start with 30 pounds and build up to 50 and blah, 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 it's going to work a whole lot better. And it's the same exact principle, treating your brain like a muscle that you can strengthen. And the nice thing about that is that it's also really empowering. I think a lot of people attempt mindfulness work and they're like, I can't do it, I stink, I give up. And teaching them that, well, it's supposed to start like this. You wouldn't expect yourself to bench press 300 pounds right out of the gate. Consider it like that this is something that you can work on. And so I would say breaking whatever kind of exercises might work for you down into small nuggets. Even something as simple to stop and take 5 mindful breaths. It doesn't have to be a full-on meditation at all. Just bring your awareness to your body. Notice how it feels to be breathing. Same idea. Take 30 seconds to be mindful of your thoughts. Engage in mindful conversation with someone else. Turn off your phone. Turn off the notifications on the computer and just attempt to be present in your experiences. Same idea with emotions. Emotions are so much easier than we tend to think they are, because we get so worried that we create what I call secondary anxiety. Primary anxiety is, I am uncomfortable with something that's happening. Secondary anxiety is then we tend to avoid that situation. And when we take away the avoidance, it's almost always the case that the primary anxiety, the actual situation that's going on, is not nearly as bad as we thought it was. Just like if I'm avoiding having a conversation with a friend because I'm nervous about how it'll come across or what they might say, 98 times out of 100, having that conversation is quite a bit easier than I thought it was going to be. So that same level of awareness, reducing avoidance, trying to be mindful in our everyday activities can really, really make a difference.
So reducing avoidance, it actually sounds like a more medically acceptable term for, face your fear. And
and mindfulness.
if it,
Same thing.
step into your step out of your comfort zone, right?
Exactly.
And most times, again, leads me to this Mark Twain quote that I seem to always recite, which is, most of the worst things in our lives have never actually happened to us.
Yeah, yeah, absolutely.
So we tell ourselves these stories about how bad the conversation is going to be, and
that's the secondary avoidance. Oh crap, this is going to be awful, and usually it's not.
Right. It's amazing how the stories we tell ourselves, and how we just build this stuff up in our heads as being so torturous. And then when you do step out of your comfort zone and make that phone call and have the conversation,
right?
God, it always just feels so good. That
it's funny. Even as you said that, you did the kind of like thing.
Just thinking about
it. Yeah. Because when they actually do it, they're like, wow, that was such a relief. That was not nearly as bad as I thought it was going to be. And I think that's the case probably 98% of the time.
Yeah, I actually I'm trying to actually incorporate that little piece into my life more. I'm trying to just kind of do one thing that I'm forcing every day to force myself out of my comfort zone, whether it's pick up the phone and try to call somebody for work related things that I wouldn't have called previously, or even incorporating them into my exercise. I have this fear of heights, so I've actually started to run across some of the bridges in Manhattan, and
exposure therapy,
things that I'd be terrified to do, and I'm just kind of forcing myself to do it, and just as part of the greater good here.
That's another really
my greater good, I guess. But
there's another really valuable coping skill. Like, as long as you're not going to totally dissociate because what you're trying to force yourself to do is so terrifying, so lower on the list. Try some of those things, because they're very rarely as bad as we think they're going to be.
Right, and I guess you're training yourself to not let your amygdala get fired up and go off into the I guess monkey mind, or whatever stories we start to tell ourselves about how bad something can be. So if you take these little purposeful steps into something that's uncomfortable, it's actually a bit of training.
It also builds a sense of mastery. That's a really valuable part too, that we very often feel like the situation is the one that has control, not us. And so we spend a lot of time going like, I can't possibly do that. And when we try something, and even if it's hard, we get through it, you have a sense of mastery of like, cool, I can do that. The situation is not in charge. That other person is not in charge. I can control how I'm thinking and feeling, and for the most part, acting.
Nice.
Yeah.
I want to move on to actually another topic, which I know you work with for combating anxiety or depression, and that's compassion.
Mm-hmm.
Can you talk a little bit about compassion, a compassion practice, or
absolutely. So I would say, if people do nothing else, practicing compassion, both for yourself and for other people, is the most important thing for personal well-being. There's a really awesome book about it that just came out last year that's written jointly by the Dalai Lama and Archbishop Desmond Tutu. It's called The Book of Joy, and it's fantastic. So that's a good recommendation. And their whole thesis is that if you want to be more joyful, which is their version of happiness, they think happiness is like too transient to really describe what they're talking about. The state of joyfulness is something that's more of like a character trait than a passing experience. And so they say, if you want to be a more joyful person, the most important thing, the single most important thing to do, is to practice compassion. And so you can do that pretty simply. In general, most people find it's helpful to start with themselves, because especially in American culture, we're not that self-compassionate. We tend to be kind of critical and even mean to ourselves. And so starting with something really basic, like once a day, in a neutral moment or at a time that you notice you're feeling down on yourself, to say something like, I love and accept myself as I am. And you might not even really believe it at the beginning, but getting into the habit of saying that, your brain will hear it enough times that your belief system might start to shift. And then we can kind of expand to others. And I'm sure you had some experience with this with loving kindness meditation practice. It's really the same idea of being able to send kindness and wishes for peace and compassion to ourselves. And eventually what we aim to do is to kind of send those vibes to the entirety of living beings. And it can really be very expansive. And I think a lot of people, as they're doing it, feel a really deep-seated sense of joy and peacefulness. And the more we practice it, the stronger it gets, just like a muscle.
Interesting. Yeah, to actually just follow up on a couple of points how you were saying, to start with yourself. And I have always heard that, it's kind of like the oxygen mask on the plane, how they always instruct you to put the oxygen mask on yourself first, because, if you can't breathe, how are you going to help somebody else? Well, it's the same thing with the compassion practice. If you don't take care of yourself, then you can't really take care of other people.
They often say that compassion for others is kind of like a well that we need to draw from. And if our well for ourselves is empty, we don't have that much to give to other people. And I think that's pretty true.
Yeah. And then I think another piece of it is so often some of our anxiety is caused by other people, right? Maybe our boss or the guy that cut us off while we were driving, and or
we got this like
right, or a family member, whoever it is. But when you practice a little bit of compassion towards those people, it softens those kind of difficult feelings that you have.
Yeah, that's a great way to describe it, that it softens those feelings. We can still feel anger, we can still be hurt. Those emotions are really useful. We don't want them to go away entirely. They help guide our relationships and our behavior. But it tends to, those feelings tend to be very pointy. And if we can soften the edges a bit, we're not only not feeling so bad, but it actually tends to open us up to be able to interact differently and more competently with those people, which can then change the fact that we're angry or frustrated by them.
Definitely. And, another thing to keep in mind with the compassion practice is that a lot of times other people's anger or actions towards us are not really because of us. They may have had a bad day. They may have their own issues. They may be jealous of something you can do. So we tend to internalize these things and make it about us when so often if you practice a little compassion towards that person by saying some sort of mantra, it just brings awareness to the fact that, all right, you know what, this is not necessarily about me, it's about them. And it's another way of just kind of deflecting it. And also it's the reality a lot of times that,
Right. People very rarely cut you off in traffic because they're jerks. They usually cut you off in traffic because they're feeling anxious about getting somewhere, meeting a deadline. They feel pressured. They're distracted because they're in some kind of pain in a relationship or otherwise. Very rarely do people do any kind of behavior because they're like, I just want to make everybody else angry.
Right. So they're going.
They do. It's probably because they're in pain.
They're going through their own issues. So really, really interesting conversation, Devon. I have to tell you, I think there's been some really good advice and tips here for anybody that may be suffering with anxiety or depression. So actually, if we could just recap.
Yeah, you bet.
We talked about doing some mindfulness techniques, social support,
grounding skills, which is getting into your body.
Grounding skills, right.
We talked about an important aspect of mindfulness of being able to notice if you're inside or outside of your window of tolerance. What else? What else did we cover? I
think we wrapped it up with compassion. And actually, what was the mantra you said again? That you...
Oh, one of my favorites to start with, because the language is so simple and it really gets to the point, is even though I have flaws or even though I have made mistakes, I still love and accept myself.
You know, another interesting thing about when you choose to kind of practice compassion, and by saying choose to practice compassion, we're just kind of talking about saying a little bit of a mantra to ourselves or with somebody else in mind that is something loving towards ourselves. But the moment you choose to do that, you are actually becoming present also. You've brought awareness to the fact that I'm feeling a certain way, maybe not so good, and you're saying to yourself, you know what, I'm going to choose to say this compassion mantra, and it grounds you, and you're basically on a certain level labeling the fact that I wasn't feeling so good. So it's very much an act of mindfulness also. Yeah,
I totally agree. It's a very present moment statement. I love and accept myself. It's just right now.
I am enough, or it's something.
That's a good way to say it. Yeah.
Excuse me. Great. I really love this conversation, Devon. So thank you so much for spending the time here on the Don't Panic Project. And where can our viewers find you? How can they find you?
A good place to start is my website, and so you can find it, even though my last name is hard to spell. It's DR, the abbreviation for doctor, DrMacdermott.com. So drmacdermott.com.
Great. And we'll also try to put a link to that underneath this interview when we put it up.
That's easier than trying to spell it.
So thank you so much, and look forward to speaking to you again.
You're extremely welcome. Thank you for having me.
You're very welcome.